Doctors, welcome back to Jab Studies Med Fun. This is Dr. Aishwarya Mukal, and it will be your first part for dermatology important PYQ images. So let us start. The first one we will be looking at are nail pathologies. Why nail pathologies is because it is important to isolate each nail pathology and remember what it is related to, so that it will become easier in the exam. That when the picture comes, the image they give, you'll be able to identify it on the spot and you won't have to dig your memory that much. The first one we have is clubbing, very common nail pathology, also known as acropathy. So it is most commonly associated with heart and lung disease. So what exactly is clubbing is the ends of the fingers along with the nails will look swollen, and that is what's called clubbing. Next we have here is koilonychia. In koilonychia, there will be spoon-shaped nails, like literally spoon-shaped nails. It will have a concavity to it, and it is seen in iron deficiency anemia as well as Plummer-Vinson syndrome. It is very characteristic for Plummer-Vinson syndrome, and it is very important to remember that as well. The next one we have over here is Aldrich-Mees lines, and these are seen particularly in arsenic poisoning. See these purple lines, purple and white striations. These are the Aldrich-Mees lines. Next one is a very common question asked in the exam, that is pterygium, and it is seen in lichen planus. What is pterygium is the epithelial tissue or the skin at the bottom of the nail root. It will come forward in a triangular projection and it will invade the nail bed. That is what's pterygium, and it is characteristic for lichen planus. Another important PYQ and expected question in the exam. Oil drop sign. So what is oil drop sign is there will be a subungual discoloration which will look like an oil drop, and it is seen in psoriasis. We have thimble nails which are also seen in psoriasis. What are thimble nails is you can see stippling. There will be stippling, there will be like a roughness to the nails, and this is referred to as your thimble nails. Bose lines are again seen in psoriasis. There will be an indentation like this, and it is called as Bose line. The next one is Muirkes lines, and these are also seen in psoriasis. These also look like striations, red and white color striations. So all of these nail changes are from the oil drop sign, thimble nails, Bose lines and Muirkes lines are characteristics for psoriasis. Next we have is onychogryphosis or ram horn nails, which are caused by trauma. So how are they caused by trauma is the nail undergoes a lot of friction or a lot of pressure over time, and basically hypertrophy of the nail bed or hypertrophy of the nail itself happens over time, and it is shaped as a ram's horn, hence it is called ram's horn nails. Next are Lindsay nails or half nail sign, where you can see that there is this half nail sign and it is seen in chronic renal failure. In Terry's nails, it is pretty similar to Lindsay's nails, but the thing is there is quite an erythematous base to the rest of the nail, and the bottom of the nail is very white. It is seen in pemphigus disorders. Our next topic is sweat and sebaceous gland disorders. The first we encounter is hidradenitis suppurativa. It is also known as acne inversa, and it is basically nodular cystic acne in the axilla and groin region. Those are your intertriginous areas. Those are some major intertriginous areas which have a high concentration of sweat and sebaceous glands. Next we have is malaria. Malaria is a very common very common occurrence during summers, and you know it very commonly as prickly heat. this is a reminder that if you have ever encountered this, you'll remember that it pricks. It pricks your skin more than it itches. So there is less of pruritus, and it is a disease of exocrine glands, and it is related to summer and hot climates, which includes erythematous papules over the skin. What we have next is Fox-Fordyce disease. It is also known as apocrine malaria, and it is a skin-colored papule. It is seen in the axilla, and it is a disease of apocrine sweat gland. Next one are Fordyce spots. Those are ectopic sebaceous glands, mostly seen on top of the lip. This is a recent PYQ. Our next topic is a very quick topic, and it is very important because all of these three questions have been asked multiple times in every single Fmge exam. The first one we have is woodlamp findings for erythrasma. As the name suggests, erythrasma meaning red color. You'll be familiar with the coral red fluorescence that comes under woodlamp when you shine the woodlamp at the erythrasma lesion. Next one is Tinea capitis. It gives a green fluorescence, and pityriasis versicolor, which gives a yellow, gold, or apple green fluorescence under woodlamp. All of these three have been asked simultaneously or one by one in the exams. So that's it for the first video of Derma. We'll see you in the next video. Thank you.